My name is Eudora Savage, and I am the health reporter with Our Health Matters. Thank you for joining us, Dr. Eleanor Lisbon.
Thank you.
My pleasure. Now, tell us about your medical profession and how you got involved with the National Medical Association.
Sure. So I'm a native of Kansas City, Missouri, and went to Howard University for undergraduate and for medical school. And there's a lot of activity in Washington, D.C. around the National Medical Association, and many of our professors at Howard were very active. So I was introduced to the National Medical Association as a medical student. And then when I came back to Kansas City, I did my residency at the University of Kansas in family medicine and started a family and got married. So was not as active with NMA, but still was aware of the Greater Kansas City Medical Society, which has a rich history going back to the early 1930s in Kansas City. And then when my schedule allowed a little more time, I gradually got more involved at the local, regional, and national level.
Awesome. Well, what role does the National Medical Association play in your professional career?
Well, most importantly, African American physicians have individually done well since integration. So now that we have integrated hospitals that allow for African American physicians to get on staff, to get privileges, to operate on people, and to treat people regardless of their race, the National Medical Association initially, I believe, kind of lost some of the mandate, because pre-integration, that was our mandate, to have training that was on par with the majority, to have privileges that were on par. And since that time, some of the profession, I believe, have gotten a little comfortable with what strides we need to make. So really, the National Medical Association is very involved in the pipeline. So we have a crisis of African American males entering medical school that is equivalent to the 1970s. So between the 1970s and now, we've gone backwards with the number of African American males that are entering medical school. At the University of Kansas, they have over 150 medical students every year. And this past year, they had one African American male enter their class.
Now, why do you think that is?
It has to do with the pipeline. So we used to have grant funding and people who were dedicated to introducing medicine at the middle school, high school, college level, but some of that funding has dried up. As a result of that, you don't have centers of excellence that really contribute to the pipeline, and that's where an association like the National Medical Association really has some power to do things locally, regionally, and nationally. So pipeline's important. Advocacy. So with the Affordable Care Act, as you know, many states have not taken that money, and as a result of that, the services to African American communities and minority communities has suffered. So the NMA is really very involved with trying to get people to talk to their local legislators to pass ACA funding in specifically Missouri and Kansas. Prior to now, we have not had that. So pipeline, advocacy, and then I'm part of the physician executive section, and I'm an entrepreneur. So one of the other things that's very important for African Americans is to not only contribute to our communities, but also empower our communities by becoming entrepreneurs and really hiring people who look like us and giving them the exposure that, as a result of budget cuts and things like that, we don't see as much anymore.
Well, what are the goals of the local chapter of the National Medical Association?
What are the articles?
The goals.
The goals.
Yeah, the goals.
Just like I said, contribute to the pipeline, advocacy, increase our membership, and really do some of that through legislative power.
Okay, awesome. Well, we've heard that there's a shortage of doctors in the minority doctors in students actually going into the doctor workforce. So what do you believe limits minority students from pursuing careers as a doctor?
Yeah, I think it's really early exposure, and that's just not to medicine, but to things that are other than football and basketball. So we are very, our communities, kids are exposed early on to athletes, and they often aspire to that, but the likelihoods of them becoming an NBA player are much lower than actually being accepted to medical school. So we have to really expose our students to science and technology. So some of the science and technology thrusts right now, getting girls interested in science and becoming researchers and pioneers, is really where we start. And we're talking about elementary school and middle school.
What more would you like to share with the community?
Sure. I think the one thing that I didn't really emphasize, and we're emphasizing here, is we have high academic standards for the presentations at our local, regional, and national meetings. So our presenters are often academic faculty. They're people who have published in major journals. They're doing research. They're doing a lot of work outside of direct patient care that really contributes to the excellence of the presentations that we have at our meetings.
Well, thank you so much, Dr. Lisbon, for joining us.
Thank you.